sorry. So we'll see the various ligaments are attached here. So we'll see the detail about all these ligaments. But here we are more concerned about the different tilts of the pelvis. So we'll study first about the various tilts of the pelvis and why these tilts are there and what is the normal position, and then we will see what treatment through the NIBS we can give for the different tilts. Ya, Mika, please translate.
Oke, jadi kita lihat sekarang wilayah sacroiliac dan berbagai ligamen yang terlibat di dalamnya. Namun, yang akan menjadi perhatian kita sekarang adalah kemiringan pelvic. Kenapa pinggul bisa miring? Apa penyebabnya dan bagaimana menanganinya dengan NIBS? Itu yang akan menjadi bahasan utama pada malam ini. Over.
There are various reasons for the pelvic tilt. So various reasons for the pelvic tilt. The common causes. So what are the possible three causes? The main thing is the posture. If there is any problem related to the posture, this affects the pelvic floor, whether it would be at the neck, whether it be at the lower limbs, right, or heel or anywhere. So due to the disturbance in the posture, so why the posture got disturbed? It is because of the muscle imbalances. Because in muscle imbalances, there are certain muscles which are tight and certain muscles which are weak. So and also the leg length inequality, that is LLD, leg length discrepancy, or LLI, leg length inequality, is also one of the cause. Yeah, translation please.
Sekarang kita melihat beberapa penyebab dari kemiringan pinggul. Pertama, itu karena ada gangguan postur yang dari sananya sudah begitu. Acquired itu dalam perjalanan hidup kita salah postur, itu yang pertama. Yang kedua, ada ketidakseimbangan pada otot. Ada yang kuat, ada lagi yang terlalu lemah. Ketidakseimbangan itu menyebabkan pinggul kita bisa miring. Yang ketiga, ada perbedaan panjang pada kaki. Dulu kita menyebutnya leg length discrepancy atau LLD, itu sama saja dengan LLI. Jadi ketidaksamaan panjang. Okay.
So muscle imbalance are the main thing. So to correct the muscle imbalances, we need to identify which all muscles are weak and which all muscles are tight. So we need to identify according to the posture, and there is fixed, you can say, pattern in which these muscles got tight or weak. So we need not to put too much thinking about how to work for the particular pelvic tilt. So because usually there is a fixed pattern, although we need to see other things also, but once we follow this particular pattern, we will be able to break this muscle imbalances structure, and we will be able to correct the pelvic tilts.
Oke. Yang paling berpengaruh adalah ketidakseimbangan otot. Nah, kita tidak usah terlalu repot memikirkan mana yang lemah, mana yang terlalu kencang, karena ada polanya. Nah, pola ini sudah tertentu. Kalau kita melihat pola kemiringan pelvik, maka kita akan tahu mana otot yang lemah dan mana otot yang terlalu kencang. Over.
Thank you. So here comes the assessment part. So firstly, we should know that certain landmarks which are there, and what is the normal posture, and if there is any movement or any rotations, since the tilts are basically the rotations. So these rotations are present or not. So through these things, we will be able to assess whether there is pelvic tilt or not, and if there is pelvic tilt, what type of tilt it is. So three things we need to see. First is the anatomical landmark, second is the posture, and third is the rotation in the pelvic tilt assessment. So in the assessment, we have to look about three things. First is the landmark. In the landmark, the ASIS, that means the anterior superior iliac spine, PSIS, that is the posterior superior iliac spine, and the iliac crest. So these three things we need to see in the anatomical landmark.
Oke. Ada 3 hal yang harus kita perhatikan. Yang pertama adalah tanda-tanda anatomis atau anatomical landmark. Itu kita lihat ASIS, PSIS, juga iliac crest. Yang kemudian harus kita tahu adalah postur normal. Seperti apakah keadaan normal, yaitu tidak ada kemiringan. Yang ketiga kita perhatikan apakah ada bone, innominate bone yang berputar. Kita lihat apakah berputarnya itu anterior atau sifatnya posterior. Kita lihat sekali lagi 3 hal, ciri-ciri anatomis, kemudian bagaimana kalau keadaan normal, dan bagaimana kalau terjadi rotasi pada tulang innominate. Apakah itu PSIS-nya itu lebih besar dari ASIS, artinya rotasi anterior, kalau sebaliknya rotasi posterior. Over.
Thank you. So there are few things we need to look upon when we observe for the pelvic tilt. So when we hold this bone, so this is the normal anatomical position of the bone in the human body. So this bone lies like this in the human body, and this is the most prominent structure. This is the most prominent structure on the pelvic area. So this is called as the ASIS. This is called ASIS. So anterior superior iliac spine. Okay, this is ASIS, anterior superior iliac spine, the most prominent structure in the pelvis region. And this would be the posterior iliac spine, right? Posterior superior iliac spine. So this area would be the posterior superior iliac spine. And this is called as the iliac crest. This is called as the iliac crest. This round shaped structure is called as the iliac crest. Okay, so these 3 landmarks we should know. First is the ASIS, second is the iliac crest, third is the PSIS, the posterior portion. Ya, Mika, please translate.
Jadi kita perhatikan 3 bagian itu. Pertama ada anterior superior iliac spine atau ASIS. Ya, itu dia. Yes. Then we have PSIS, posterior superior
iliac spine.
Iliac spine. Dan kemudian iliac crest, itu yang lengkung, the curved one, yang lengkung. Yes.
Thank you. Here if we see that this is the area, this is the most prominent structure. So when we feel around this area, okay, so the most prominent structure we feel the bony portion, the bony area just above the leg in the pelvic region on the side of this side of the body. And when we feel palpate around this area, so the most bony prominence, the most bony area, bony portion is the ASIS. So ASIS would come around this area. So on both sides we need to check that whether they are at the same level, or one is up or one is down. So this thing we need to check. Okay, so these are the ASIs with the black dot mark. With the black dot mark. So these are the ASIs on both the sides. We need to palpate, and also whether we need to see whether they are at the same level or not. So they should, ideally they should be at the same level, right? So this is ASIS and they should be at the same level.
Kita lihat bagaimana cara mencarinya. Jadi ASIS itu tulang yang paling menonjol. Kita cari yang ditunjuk oleh Sir Rahul, lalu kita bandingkan level kiri dan kanan. apakah sama tingginya? Kita harus cek. Oke.
Okay. Sir has come. So sir may take over. Pranam sir. Okay, sir is in the waiting room. Yeah, no. Hello, Pranam sir.
आ गया
जी सर.
Pranam sir.
तुमको देखने से मजा ही लगा.
Pranam sir.
You know, God made a wrong cross connection. If Rahul had been a girl, I would have a wife today. But luckily, God did not make him a girl, so I am suffering now without a wife.
But now there is another relation, sir.
Huh?
Father and son. Now there is another relation of father and son.
There is a problem, nah. If it was my wife, I would have not to work. He would have worked and I would have slept at home.
No problem, sir. You can do the same work with your son also.
Anyway, Walaikum Assalam. See, my students are also here, you are also here, so I'll teach both of you all together.
Thank you, sir.
I'll take only 30 to 40 minutes of lecture because my health is not very good. But it is enough. My 30 minutes are more than enough for you.
Sure.
See, whenever I speak about anything, see, you will see one patient of Parkinson's have been revived in just 2 days. And Rahul, you know that boy, he can stand now. That small boy which you were treating on the last day.
Yes, sir. Yes, sir.
Is a miraculous recovery we have done.
Wow.
The boy can stand by his own, and they are coming day after tomorrow to Hyderabad.
Wow, wonderful, sir. Wonderful.
You tell them what was that case?
So, the cerebral palsy, it was a case of cerebral palsy, and it was basically diplegia, and both the legs are very spastic, and the child has so much reluctant to, you can say, communication. He usually stays with her aunt, and he doesn't go to anybody for the treatment, and he was so reluctant on the first and the second day that he
no, not this one.
Okay, which one, sir?
The last day patient, hypos is 55 degrees.
Oh, okay. Oh, wow, that one got stunning. Wow. Oh, that is an amazing case, sir. Wow.
Here's the photograph of the child. Now show them.
Yeah, I just see it. I'll send to Vinny, sir. So that was the case of. Just a second, sir. Just a second. So that was the case who has the scoliosis, and it was 55 degree of scoliosis in the.
Show them the photograph.
Yeah, I'm trying to make out. Yes, sir. And that scoliosis was corrected to 45. I think we got the correction of 30 to 35 degrees, and only 10 to 15 degrees was left, and he was completely bedridden, and there was no movement at all, and he was suffering from epileptic attack. That one, sir. Epilepsy one, na? Sir?
Perhaps he has a call.
Okay. Yes, I'm sending the photographs. Yes, that was the epileptic child who had seizures, and even when he was there for the treatment, he had the seizures 2-3 times there only, and he was completely on the drugs from last many years, and there was all the muscles were completely dead, and there was no movement at all, whether in the lower limbs or the upper limbs. And sir has done 1 day of treatment only for him, and after the treatment, his scoliosis got corrected. I've sent the photographs to Winnie. Winnie, can you please share those photographs here? Yeah, and he was not able to sit, he was not able to stand, and even the neck holding was also not there. So he was such a severe condition that we thought that this child would never recover, never. It was a condition like that. And we did, sir did the treatment, and after the treatment he was able to sit with partial control. And today, as sir said, that he would be now able to stand independently, and this was an amazing recovery. I think we never thought of that he would be able to stand independently after one first treatment. So that was a miraculous recovery, we would say. And we will short while just share with you the photographs of the patient, and we will see.
How old is the kid?
He was around 7-8 year old.
Thank you.
Yeah. Yeah, Winnie is sharing the photograph. So this is the boy, and is this one, sir?
This is the boy.
Yes. So this is
And
the boy.
he's having epilepsy after every 1 hour.
Yes, sir.
So he is having 24 seizures in a month, hour, 24 to 30 seizures.
Yes.
And no one was able to control his seizures, and neither he was able to stand. I just opened the CSF pathway inside the brain and the spine. His seizures have reduced greatly. This is what Radhesham was saying me yesterday.
Wonderful recovery, sir. Wonderful.
It was actually the case of Dr. Radhesham. He's an American GI surgeon who works with the cancer biomolecular medicines using herbs. So this patient was actually, his father is in very high post. He's a convener of BRICS International Bank in Hong Kong.
Yeah, few more photographs are there, Winnie. Yes, sir. Yes, sir. We can hear you. Yeah, few more photographs are there, Winnie. So he had a scoliosis of 55 degrees.
This photo is after correction. So here you can see how a beautiful case can be recovered if you have certain damages in the spine and brain. See, ultimately you have to understand why these people could not recover, the best neurologists, because they do not know how to correct the kyphosis and scoliosis. We knew the procedure. We inserted the needle, we traced the pain, and the patient recovered in one session. Imagine 55 degree scoliosis. There was an orthopedic surgeon with his husband, and he himself certified that the patient is recovered by. And now the patient is healthy and is coming for further treatment to what? Hyderabad.
Amazing recovery, and that too in just a one sitting. He came on the last day to us, and with just one session, it is an amazing recovery. He was suffering from last so many years, and there was no cure. They were finding no cure for these things, that for recovering from the epilepsy, even after giving the highest doses of drugs and highest doses of these medicines. He had an epileptic attack every hour, each hour. In if I think he was there for 2 or 3 hours. In that also we saw that he had an epileptic attack 3, 4 to 5 times. The moment he came, he sit on his mother made him sit on the chair. Only at that time also he had an attack, and but with the treatment, his scoliosis also corrected, and now as reported that his mm, the epilepsy also would have been reduced, and he's able to stand. That would be the amazing recovery, sir.
So next, second case I like to put forward is the case of Parkinson's. This case is a 12 years old case of Parkinson, and I'm very happy that Katyal was wonderfully working with me in this case. This is a case of MCA infarct. This patient was having multiple infarct along with gangliocapsular region, and he was unable to walk. You see, in one session he was able to walk. So that video also we have the statement of the patient, the statement of his wife, and everything is with us. The live video is in the Facebook. Number 2. Number 3, we recovered another critical case of 12 years old Parkinson's. There were 2 cases that arrived with similar symptoms of Huntington's disease. What is Huntington along with Parkinson's?
Yes.
So you can see that video, and I will request Katyal to put up the video because it was taken from his mobile.
Yes, sir. Vinny, can you take up that video from the groups? In the groups also we have. Can you take up that video? In today's only, sir has sent in the various groups. Or shall I send to you now? I have sent you now. Yeah. So Vinny is putting up.
Namay sudah Andre Jobe. Hotdog puno.
He was having Huntington's disease. He was having tremor like that guy. Movements. Tremor with movements. His whole body was stiff. This, I don't have time more than 10 minutes. I recovered him in 30 minutes. Run.
Here it is.
So here you can see a very beautiful patient of Parkinson's who came with lot of stiffness, unable to walk. He was walking with his stick. Somehow he could maintain his balance. Now you can see the patient is able to walk independently, and also you can see the patient is able to run. Please run. Okay. Continue. Stop. Continue. Run. Stop.
Excellent.
So you can see this is a very beautiful pattern of needling. This is called hybrid needling, and it gives instant results in Parkinson's. क्या नाम है आपका?
सुधीर जाधव।
हाँ, बताइए आपकी क्या तबीयत थी, क्या प्रॉब्लम है आपको?
13 साल से कंटिन्यू चल रहा था।
और आप
पार्किंसन का।
किस कंडीशन में आए थे?
अभी शेकिंग बहुत हेवीली हो रहा था पहले।
And more important part of this patient was that he used to take 800 milligram of syncopa per day, which was supposed to become 1 gram, means 1000 milligram of this one. And no one said that this patient can revive. But then we tried, and it was the team of Katyal which I could do it. That is why I say Katyal is one of the finest students I have, because there is no restriction. You can see how the patients revive. So here you can of 12 years, you can walk upper authority. Stop. Run. Stop. Turn back. Walk fast. Walk. Stop. Slow. I did that case. Rahul did not do. All time Rahul. All phases of walking, coordination, this patient is okay. This is a needling pattern today. This is your problem. I do the case, you take the credit. क्लास करवाया मुझसे 4 दिन में कितने घंटे लिए मैंने आपके इलाज में? I bring this student, I give you to teach, now they are saying only Rahul. Hey, 2 hours of treatment. Be careful. I'll throw you out from the classroom if you say only Rahul. So you can say just in 2 hours every patient. 4 sessions too, in 4 days. And I'll push you from the Mount Everest, even your bones will not see it. That's it. First of all, I'll take you to Mount Everest and then I'll push you from there. Rahul. अच्छा फोड़ देगा हम तुम्हारा.
Question. Did you insert the needle and then you tie the needle or what?
You saw them the photograph. Today one girl has taken. Arvelin from
Arlene from Philippines.
Tell her. I don't tell the name of my room. It is MK Shastri room. Why did you put NIBS room? Again, Vinny, I'll break your head. I'll teach all wrong things in the class if you change my name. Then don't tell me why I'm teaching wrong things. You do wrong, I'll teach you all wrong. NIBS. Are we teaching only NIBS? No, we are teaching the recovery of neuro rehabilitation. Don't change things like that. Else I'll have to break your head. And also I'll break the head of Rahul. Then he'll be on the bed, I'll be also on bed, she will be also on the bed. Class suspend for 2 months. What is the use?
No, sir, don't do that.
So this is what you do. You break the total circuit. What is the problem with the patient? Problem is the damage inside the brain. Did you revive the damage inside the brain? For me, progressive supranuclear palsy is the easy case. But is it for you? No. Because you do not know how to revive the damages inside the brain. How to enter the brain, how to revive the circuits, how to work with the neurotransmitters inside the brain so that the chemical reaction which should take place,
Sir, may I ask?
Yes.
You say about hybrid needling. What do you mean by hybrid needling?
I did not say this hybrid needling. I said hybrid means what? 2 needles connected to each other in a different pattern, in which one is pulling, one is stressing. So it is called tension traction technique.
Oh, okay. Tension traction technique, yes.
Yeah, but before that we applied the different techniques of brain stimulation. in different person, and we got these results. 3 days, 3 types of technique stimulated by brain and advanced brain stimulation. Now we have developed one good Parkinson's pain. So all these patients who are suffering from Parkinson's should be given Parkinson's pain. Those who are suffering from autism, they should be given an autism pain.
Oh, so there will be a special pen for Parkinson, do you mean?
Yeah, because Parkinson is a progressive disease. It will destroy the brain. The brain size will shrink and the patient will die.
Okay, thank you.
So working with Parkinson means you are working with death. And any type of Parkinson patient can have heart attack.
Oh.
Immediate cardiac stroke. Because
Why?
dopamine, Parkinson means what? Reduction of dopamine in the body.
Yes.
The moment the dopamine level falls down, there are the chances of heart attack.
Oh.
And this is the first choice of medicine whenever there is a heart attack in ICU. And in the cases of ventilation, we put neoadrenaline with dopamine in hourly basis through a syringe pump. So we calculate the meter dose, and after every 1 hour, that much dopamine is inserted inside the body through the syringe pump. That we call it automatic system. We set the dose, 5 ml required after every 1 hour. So every 1 hour, 5 ml of dopamine will be inserted. Then the next hour adrenaline, then again next hour dopamine. In this way, 2 syringe pumps are connected for the patient. One is dopamine, one is neoadrenaline. Now what happens whenever there is a damage? What will happen? You do not know how to recover the damage. Rather you try to work with the peripheral areas. So damage is not recovered. Once the damage is not recovered, it will damage more and more things inside the brain. So the more and more you damage, the more and more destruction comes. So the best method is that how to enter the brain safely, how to execute your work, and then to recover it. I just give you a small example, and that the baby is coming tomorrow or day after tomorrow. You can see how healthy he is just in one session. I think Vidut is not there. Vidut?
She's here.
Vidut?
So she has fever. Maybe she may be resting.
Her daughter also had a fever. I think both of them has COVID, I think.
No, sir, they have done. Just I have talked him in the class only. So they saying they are both are negative, sir.
So you asked something on Parkinson's to me today. Kia Kai Yin Chua. Ki Yan Chu. Ask me something on Parkinson.
Yan, sir's calling you.
Oh, Henry, my dear friend, after a long, long time, it was like I am on honeymoon and I have come after the honeymoon and I am seeing your face. I was too busy because of the IPD. Again, from tomorrow, I have a lot of IPDs here. Inpatients. And these are all critical cases.
You are a very busy guy. You know, you've been helping a lot of physicians. I mean, a lot of patients. We just I'm just tagging along just to ensure that I learn something from you. You know, I've been grateful for your help, for your broaden my broaden my knowledge.
See, one thing I tell you. One small thing I want to tell you. You see this Parkinson's patient. You see this paralysis patients. You see the most important is what? What are you looking for? Water?
Me?
Yeah. Then why are you showing the finger mouth?
No, because I was telling my second son, because a friend got COVID, and he is afraid that he might get it. So I said, like use saline solution to clean his throat and also his nose to start with. So I guess that's the right way. I mean, I because there's nothing that you can do when you don't know whether you're exposed to it or not. So, and I don't have any test kit with me anyway, so that's why.
Let him suffer.
Huh?
If he's having COVID, what is the problem with COVID? I got 3 times COVID, nothing happened. I'm waiting for the 4th time.
You're waiting for.
I will have the 14 days rest.
You have the immune now. He doesn't.
Oh, it is Indian immunity. That is Hong Kong immunity. That is the difference.
Well, anyway, I'm getting an injection this Sunday.
I'm not getting any injection.
Sinovac. The least, I would say, the least effective. That's the one.
The least effective, that's the one you are taking.
Yeah.
Anyway, so whenever you see this type of patients, what is required is to safe passage inside the brain. When you enter the brain, you create reactions and you come out. So meanwhile, from tomorrow again, I'll have so many cases here. All are very critical, and then we start our night round after Rajaram comes at night, 8 o'clock, which is by 10:30 of Singapore time. And we continue up to 4 o'clock in the morning.
4 o'clock in the morning?
Yeah, 4 o'clock by Indian morning, and Singapore time is 6:30. Hong Kong time is 6:30 in the morning.
Yeah.
We recovered a patient. We start our IPD round because there are 10 to 15 patients in the IPD now from tomorrow. So that's the reason I won't be able to take many of the classes these days. But don't worry, whenever you come to me, I'm preparing a good foundation for you so that I can take you to Krishna Institute of Neuroscience. I can take you to ICU. And Dr. I.P. Cherry is establishing 120-bedded neurosurgery. So you will get a lot of wonderful cases of all types of brain damages, aneurysm, post-operative coiling aneurysm, post-stroke cases, variety of post-stroke. It is like post-stroke in gangliocapsular region, motor stroke, damage in both sensory and motor pathway, voice pathway, that is Broca's and Wernicke's area, all damage. So the brain, what you will get is a damaged brain. Now, how to repair this damaged brain, I can teach you very easily. Wow. It's just like a cup of tea, but you have to drink sip by sip. That's it.
You mean Indian tea?
For me, paralysis is just like a cup of boring tea now. That is why I have done one thing, I entered the kitchen. Because I am so much bored with paralysis. There is no more excitement in paralysis. Parkinson, paralysis, no more excitement. It's a routine procedure. It's routine procedure like as you kiss your wife. How many go and kiss their wife as a routine procedure? How many, I think Filipinos do every day. They kiss their wife. French kiss every day. So kissing their wife and what do you call, treating Parkinson is same. It is a routine job. You enjoy kissing your wife, I enjoy my wife. Brain is my wife. I kiss it very nicely. And then when I kiss it, so when I kiss it, I get a beautiful result in Parkinson's. I get a beautiful result in paralysis. I get everything. So at 9 o'clock, my friend will come. रात को रूम में कौन होता है? रात को कोई है क्या? कौन? बाबू, आप कितना दूर है आपका घर? तभी आप जाता? अभी 8:30 बजे हमारा वो फिजियो आएगा राजा ना, तो हम ट्रीटमेंट चालू करेगा। इसलिए पूछा कौन रहेगा। मम्मा है? नहीं, सुबह जरूरत नहीं है। We don't want him in the morning. We want him in the night. So we will give you one bed to right. If required, you can sleep. कोई नीचे का एक रूम दे देना, सो जाए। We have 4 extra rooms right now, 3 extra rooms. We occupy the room and sleep. Right? After the treatment. Then treatment continues from 8:30 or 9 o'clock in the night, 9:30 to 4 o'clock in the morning. उसमें तुम्हारा पापा का कितना बजे राउंड आता हमको नहीं मालूम। You understand? You tell them by phone. हम 1 बजे भी जा सकता है, 12 बजे भी जा सकता है। I can go by night 12 o'clock also. I can go by 1 o'clock also. Right? So tomorrow you make sure that you are here. Huh? Okay. Thank you. No need to worry. If he is there, one male boy is required. That's it. Because we are going at night, 1 o'clock or 2 o'clock, ladies are there. So I feel reluctant for that. Okay? Thank you, sir. But today I'll treat, these boys are there. I'll complete slightly, I'll take your father case, the first case, followed by other case. Okay. Thank you, sir. Thank you, sir. Okay. Sorry, I was talking to patient attendant.
Okay lah.
Because this is another case which has done tracheostomy, brain surgery. Patient neither can stand nor can walk, and I will see that by tomorrow he starts walking. Aja, tell me how many of you can recover paralysis on the same day? One sitting. How many?
None.
Oh, very bad of you. Why can't you recover? You should recover. You are my students. So once you attend with me in the medical college and day and night duty you will do, then you will know how to recover patients very fast. Right?
Yes. Waiting
Once you do
eagerly for the
practically,
time. Waiting eagerly for the time to come.
no need to wait. You keep learning. When the practicals will come, you don't have time to study the theory. Because that's why what is aneurysm, how to examine the MRI, how to do all these procedures. You won't be able to have the time. Practical means what? Totally practical, dedicated practicals.
Okay.
You must learn how to repair the damage inside the brain. What you must learn? How to repair the damages inside
the brain. How to repair the damage inside the brain.
If you cannot repair the damages inside the brain, nothing will take place.
Doc, can I ask you a question?
Oh, always, my brother. Without your question, I feel sleepy. I'm addicted to your questions.
No, just on your Facebook about the Parkinson lady. You were working on the speech part, and I saw you using 3 fingers up and 3 fingers back. Can you say this again? So, because I want to apply for my mother.
That was placebo.
Sorry?
What I was saying was a placebo.
Placebo. Not the real one to be done. Placebo.
That was a placebo. placebo, placebo. Nothing to do with the treatment. Already I had given a brain stimulation.
Placebo?
The
But
needle
you-
was with a three finger right, not
You
here,
were-
not this
you were-
one, side one. No. This one. You are speaking about three finger right, two finger.
Yeah,
This is
yeah.
the temporal lobe. That was
Yeah.
placebo.
That was placebo.
I already did it. I already recovered the voice.
by doing here.
Yes, the signal starts here in the prefrontal cortex, not on the Warnicki and Broca's area. But then everyone questioning me, you did not stimulate. Okay, I said, I'll put Venus very carefully. I went only in the which area? Muscular area of that area. I did not touch the skull. I did not stimulate anything. I just inserted it in the skin and I left it.
Okay.
Be careful when I am practicing. Ask me what I am doing. Because some people of you, so many people question me so many nonsense. You are not the only one. I have to teach more than 1,000 students different areas. Medical doctors are also there. They question me so much. So I also say, go and stimulate. What is my problem? It is your patient. You must know exact brain mapping. How to enter the brain, where to stimulate and where will you get the reaction. To take out voice, you do not need to stimulate the Broca's and Wernicke's areas always. You can do many things without that. Right?
Okay. Because when I saw the front here, I thought you were stimulating the sacrum and the lumbar area. So I thought, when you're stimulating the speech, so you go this way. That's what I thought anyway.
This is what I say. The moment you see the brain, it's not what you see.
All right.
See, brain is not what you see. Brain is what there is a damage and how to repair that damage. It is called neuroplasticity. So you have to get neuroplasticity for the voice, for the taste, for everything. You cannot do whatever you like while recovering the patient. You have to obtain a pathway from the anatomically damaged area. Certain location of the brain is damaged. So how come you overcome this damage and revive the brain and you go ahead with the journey? You understood?
So what you're saying is that you were stimulating the brain. Well, what we learned from you was the area you were working on her was the lumbar, was the sacrum. That's all I saw.
No. Which case you are saying about Parkinson's?
Yeah, the lady's Parkinson's. Sorry, yeah.
No. The Korea patient, I do not treat the. See, there are different mappings of the brain. There is not only one dressing skull.
Okay. No, but it was here, right? You were here. It was here.
No, it was here, but you see the pattern of needling. Evelyn, can you produce the photo? Arlene, can you produce a photo? Oh, Arlene, he baby,
Yes, we sent to Vinny, sir. Vinny may also put up.
After cutting her hairs, her brain has gone to her feet. Earlier hand was very good. She had long hair. Now when she has cut down the hair, brain entered in the feet.
Vinny, can you please share?
Eileen's brain is now in the feet, not in the brain skull. It has been dislocated.
Don't have any photo in your.
What she's saying, she only knows. God knows and she knows.
Arlene, your voice please, Arlene.
Arlene, see Arlene, hear me, Arlene. Your brain after cutting your hair has gone to your face. So your voice is not audible. That? Your voice is not audible. Don't you hear or what? Hey, mute our mic. So, can we get the photo of the needling pattern and then I'll go. My time is over.
Yes, sir. I'm trying, sir. Just a second. Got it, sir.
Hello, Dr. Rahul.
Yeah, here it is, sir.
So this is the needling. So how you are using the spine? Listen. हाँ क्या बनाने का ट्रीटमेंट कर रहा है गधा को क्या मालूम घोड़ा क्या होता है Okay, you have any question to ask?
Okay.
In between, whenever I get time, I'll treat. Sometimes at 7 o'clock, sometimes at 8 o'clock, sometimes at 9 o'clock. Whenever I get time, I'll treat you for 30 minutes, 40 minutes. The rest the class will run by Rahul. We'll find one or two. Vani also will take some classes now.
Okay, sir.
G, can I ask a question?
Yes, G.
What technique you call this one?
Tension traction technique.
Oh, I see. So if it's about tinnitus, is there a special way to treat?
Tinnitus, we have not worked. Actually, there is a ENT doctor who has joined me. So now I am going to revise my whole anatomy and how to revive that anatomy from the brain.
I see. Okay.
So now we do not treat any tinnitus patient in this clinic with NIBS. We are trying to find out the pathway inside the brain.
Right.
Which part of the brain is this picture? It's so close.
It's the scalp in the central area we used it.
Center area. Okay.
Yeah, it started from the central area and we entered in the different areas of corpus callosum and ring. It's a different mapping. It's a brain mapping.
Henry, look at the video at about 1 minute 05 second.
Okay.
Any question? Kai in Chua. Any question? Any question?
Yeah.
Hi.
How long you leave the needles?
I left it only for 5 minutes. After that, we took out the needle and the patient went away.
A patient walking.
Patient is walking, running, everything we tested the tremor and then we removed the needle and we made him go away.
So what was the initial condition?
The patient cannot stand, cannot walk, cannot sit.
For how long already?
12 years.
12 years. Wonderful.
800 milligram, 4 dose, QID.
Pardon?
QID, 4 times a day, Syndopa. This dopamine tablet, Syndopa.
800 milligram.
200 into 4. This is 800 milligrams.
Well done. Congratulations.
12-year-old case, right?
5 minutes, huh?
Huh?
5 minutes the patient running already.
This is what I said now. When you understand the damage of the brain, you don't take time to recover a patient.
Sir, is it all just like paralysis that Parkinson also had many types? Is there many types of Parkinson also?
No. See, now Parkinson's when go to an advanced stage or a higher stage, it develops lot of damage inside the brain. So it may go to Huntington also. It may create more and more problem. It may create the toxicity in the liver because of the high medicines you are taking. कुछ भी करो ना यार.
So it seems to be just one kind of Parkinson in the advanced stage.
No, see, it is not an advanced level of Parkinson.
Oh.
It is not a preliminary because it is a 12-year progressed Parkinson, which has damage to Huntington, and then now the patient is about to die. After you enter the Huntington's disease with Parkinson, patient may go bedridden, the body will be stiff, he won't be able to speak, he won't be able to see, and then he will die.
Oh.
He has to carry that motionless state without speech for more than 1 year, and then he will die.
Oh. Because degenerative, so the case will be worsen and worsen day by day if it is not treated properly. Yeah.
Yes, 200%. All the neurology patients are like that only.
Okay, thank you.
That is why I say myself, I am the guardian of neurosurgeon and neurologist and physiotherapist and new people. Why? Whatever damage you make, I have to correct it.
Yeah.
I am a troubleshooter for all you people. Because my basic thing is I don't work now on muscles. I work with the anatomy of the brain. And I create a cocktail inside the brain of neurotransmitters. And the work is done. I need an appropriate chemical reaction which will repair the brain. That is real neurology. Right?
Yes. So all we need is a proper chemical reaction in the brain.
You are right. What we need is a proper chemical reaction, and to get that proper chemical reaction, we have to insert the needle in the right way, right direction, right depth, and put a correct brain stimulation. Stop it.
Over.
How many minutes job? 1 minute job.
Wow. Okay.
Shading brain is just 1 minute job, and after 2 minutes you will get the results. But then, to create that 1 minute, you have to create an environment inside the brain. Sometimes it is easy, sometimes it is tough.
Yep. Thank you.
More questions? Any more questions?
So, based on your pictures, you connected with this all the needles are connected, and that's all you have to do. You don't need
there are a lot
pen.
of things. There are a lot of things. You cannot just say that connecting needle to needle you will get the relationship. You have to create a pathway inside the brain to get the relationship.
Okay, so all right, you create a pathway.
See, needle always create a pathway.
Okay.
So if you want to get for me with me, you can also come at 6:30. 1 or 2 people from you. There's a serious case who is having fractures, is bedridden from last 3 years, 2 years. Orthopedician have said she will never be able to walk because she has entered the advanced stage of Parkinson. And according to me, it is very easy to make her walk. Only she had a fracture, so I could not put stand up. Now once the fracture part is over, she will dance. What is the problem? So, any more questions?
Yes, can I ask a question?
Yes.
Okay. So it seems that every time the seminar you have a breakthrough. So this time it seems that your breakthrough is to treat with the neurotransmitter. Am I right?
Yeah. You can say this time I had a very good research. Because when I was speaking to IP Chadian, we said a new idea. And that idea really worked out. Everything, whatever I learned, has changed to a new dynamic functioning of the brain. Now with this new idea, I am trying to integrate what? The temperature of my brain also. Now without needle, I want to stimulate the brain of other person and get the same result. Brain to brain stimulation. And I was the more faster result than what you are getting here.
So is it a better technique or is it just another alternative?
It is authenticated technique because we recovered IP Chadian's father who was suffering from progressive supranuclear palsy PSP. So, see, every time whenever we work with brain, whenever we work with the disease, we always feel we have done sufficient now, I think no more to do research. But suddenly a patient will come, like tomorrow a patient is coming, post-COVID patient. She was having hypoxic insult. From last 2 years, she is totally bedridden. And nothing has proved right. So now they are coming here.
30 minutes na nakatapos. Meron ako ng 12.
G, one question. How about dementia?
See, dementia is again what? The deposit of tau protein or amyloid proteins in hippocampus, substantia nigra below the hypothalamus and in the prefrontal cortex. So the proteins which are called alpha beta proteins, alpha beta amyloid proteins or tau protein, they eat the what? The neurons, and then damage the neurons, and these neurons which are recovered by glial cells cannot take place. So when the neurons are extinct, you lose your memory because the memory is coded in the neurons.
So any chance for recovery?
Chances are always there, but then what you are treating, what pathway has to be taken, who is the treatment doer, what is the experience of the person, what is the patient status, whether the patient is really ready to cooperate or it is like a hanky-panky patient.
The patient is blurred.
So it all has to be worked in a proper way. Otherwise, no one can treat Alzheimer's. No one can treat dementia. All these diseases, whatever you are speaking, you can recover because I am saying you can recover. Otherwise, you go to any doctor in Singapore, France, Italy, no recovery because I treat this patient every day.
Alzheimer as well.
Alzheimer is nothing great. Just you need to clean the proteins using the lymphatic system, G lymphatic system. Send CSF fluid inside the brain using Brownian principle, using a cocktail. The amyloid protein deposited will be cleaned up. The moment the amyloid protein is cleaned up, you give another signal pathway to create the neurons that will get neuroplasticity and the memories are there. The loop is corrected. Basically, the problem is in the loop circuit.
So what is the cocktail about?
It depends what kind of cocktail you want to develop and how will you develop. It's about the neurotransmitter. Little bit dopamine, little serotonin, acetylcholine, 30% acetylcholine, I need 20% this, 10% this. So I may need to create 120 ml of cocktail or 100 ml of cocktail or 60 ml of cocktail.
So the cocktail is basically talking is consists of neurotransmitter, right?
What is else? What cocktail you can create in the brain? There is only electrical and chemical.
Oh, so it's not like you're doing the NIBS.
See, when you are working in NIBS is a broad term. You have learned only one method, which is the neuromuscular technique. You did not learn anything advanced here.
No, I mean the cocktail you're referring is not through injection.
No, through dry needle. Now I'm trying to do it without needles. I'm trying to stimulate brain to brain. I'm using my brain to stimulate his brain.
Wow. So would that be an influence affecting your brain as well?
Nothing will affect my brain. My brain is strong enough. Why will it affect? I treated so many patients in every places. Why something will damage? Do you think my brain is weak enough that any Tom, Dick, Harry can damage it?
So you can call that the kissing technique.
See, these are various methods. Various
so
rituals.
Your brain rub against the Alzheimer patient brain. Then the patient
see, Alzheimer's, the problem with us is that we do not know anything about the neurology anatomy. We don't know all these tough advanced cases which even a neurologist cannot do. The best neurologist of the world also cannot do it.
Right.
So, did you study anytime neurology? Did you study the prognosis anatomy of the diseased brain? Functional anatomy? No. That is why we are confused. That is why I told you to learn. That is why I told you to buy oculars. You all did nothing.
Yeah.
That is why you get confused. Revise again and again anatomies. Then it will become very easy for you to understand how brain is getting damaged and how to revive the brain. That's it. Clear?
Thank you for your knowledge.
Oh, anytime. My knowledge is hopeless.
Can I clarify one thing?
Yes.
No, so now you're using brain power to treat. So your needling is such a placebo effect. Am I right?
No, see. We have been using this technique in India from last 3,000 years. I'm trying to master and understand. Because recently we revived one patient with advanced stage of brain tumor using the same stimulation with IP. So we are trying. Let me see how much I am successful. I did not claim anything, but I am trying it. And I am getting success in many cases. In Pune, we hardly used only 90 needles for 50 patients into 5 days. Total needles we used 80, where I used to use more than 4,000 needles. Now I use only 80 needles.
Less and less needles.
Yes, after some time I will use no needle.
Just brain to brain.
Then let us try. What is my harm? I am a very scientific man. I don't do things wrongly. If I am doing something, I need results. I'm just like a business investor. If I invest, I need money, my investment back. I need ROC also, I need ROI also. Return on investment, return on capital. Yes, you are not paying me money. I don't want money also, anything from you. I just want that you prove yourself in your clinic, recover your patients, earn money, that's it. Right?
Okay, thank you so much.
So
One
any
more
more
question.
questions?
One more question. So after you're using your brain power to treat, do you feel tired? Or you
No,
feel
not at all. I continue up to 5 o'clock because I have to teach again 2-3 students for 5 to 7.
Yes. Okay.
And tomorrow 6:30 I have a home visit on my friend's house. His wife is sick. Hanmant Rao, my lawyer. Any more questions?
So, I still don't get about the Parkinson, the one that you just need. You said, okay, you're saying that you only this is only one step, like having the needle connected needle on this on the scalp area.
Anything you are doing inside the brain is just writing a programming language. It's like an algorithm writing inside the brain. You have to clear the bug from the software of the brain.
So step one, you detoxify the brain. That's what you're saying.
No. I don't do too much detoxification. I create a pathway inside. Detoxification will take later on because after I do also so much chemical reactions are taking place. Detoxification is taking regularly. So your every night when you sleep, detoxification takes place. But removing that dangerous protein, it takes time.
All right. So step one would be
Katyal.
Yes, sir.
Rahul, Babu,
Yes,
आगे मान लो.
Okay, sir. Right.
Thank you so much. I have to go. Huh?
Thank you, sir. Thank you
Katyal
for
will
your time.
answer you further.
Thank you so much, sir. Thank you, sir.
Thank you, sir.
Thank you
so much, sir.
Thank you so much.
Thank you. Thank you all.
Thank you, sir.
Thank you, sir.
Thank you,
Thank you.
everyone.
Thank you, sir.
Thank you, sir. Thank you, sir. Thank you so much, sir.
We are continuing the class for another 10-15 minutes.
Okay.
Okay. Dr. Rahul,
Yes, sir.
I'm a little bit confused. Can you summarize in terms of using like a point form into step and what Dr. Sastry has done? Like step one, what did he do on the Parkinson? Step two, what did he do? So I can have a clear idea. Now it's like a jigsaw puzzle. I have a bit of everything, and it's like a bit lost.
No problem. We'll go gradually because sir does the different ways of treatment. Like this one we were discussing these days on the classes. These are for the neuromuscular problems, basically.
Right, yeah.
So whatever NIBS and all these things we are discussing, these are for the neuromuscular problems, right?
Yes.
We can improve the power, we can improve the strength, and we can make their condition better.
Right.
But when there is a damage in the brain at particular level, right? For example, the damage is there in the internal capsule of the brain, right?
Yeah.
So we need to approach until we do not with the damage of the internal capsule, patient has got the stroke, right?
Yeah.
And due to that, there is weakness of the upper limb and the lower limb and whatever clinical signs symptoms which are there in the patient, right? So through the neuromuscular map, we can improve the power to the certain extent, right?
Yeah.
But we cannot we do not do any treatment for the repairing of the brain.
For the what of the brain?
For the repairing of the brain.
Correct.
Repairing of the internal capsule.
Yeah.
Right? So there are certain approaches.
Right.
There are certain approaches along with the improvement in the power in the upper limb and the lower limb. We have to correct the root cause, that is damaged area of the brain. right? So for that, there is a concept of synaptic plasticity.
Yeah.
Okay.
Yeah.
So in the synaptic plasticity, there are a few things like the area which is not working or which has damaged, certain other neurons around those areas needs to be come up for taking the role of the damaged area.
Correct.
Right? So for that, we require certain approaches. We require certain approaches so that we can reach the area around those the damaged part of the brain.
Yeah, the internal capsule.
Yes, the certain pathways has to be made to reach that particular area of the internal capsule.
Correct.
And also, not only this, we have to make a connection which has been lost. Like whenever there is a damage in the internal capsule, there would be the damage from the prefrontal cortex, frontal cortex, and all these areas also get, you can say the communication between these areas also would get affected.
Correct.
Right. So along with the reaching the damaged area, we need to re-establish the connection in between these areas of the lobes. So for that, we need certain advanced form of treatments. So that is what the Shastri sir is talking about. And earlier sir used to do with the needles, but now Shastri sir no more require needles, and sir used to stimulate with the brain, with his brain, the frequency of his brain, the patient's brain.
Okay, so
like for example, in the last seminar we did on the Pune here, it was the 3-4 day seminar, and sir, sir has used needles only in that the Parkinson's case only. Rest of the patients sir has treated without needles, without using any needles.
Yeah, by using his brainwave to connect to repair the patient.
Now sir has reached the level that those areas which sir was stimulating earlier with the needles, making the pathways to reach the brain, improving the damaged areas, making the communication with the different lobes of the brain. So all these things would have been done. So although we may or may not reach, I think we will not be able to reach at that level, but if we would be able to do with the needles, that would be sufficient for us. Yeah.
Definitely, yes.
Yeah. So we need to understand the brain anatomy, and we need to look upon which all areas are around the surrounding areas, and so that we may take the help of the surrounding areas to revive the damaged area of the brain, and that is called as the synaptic plasticity.
Okay.
Yeah, so we need to work on, in short, we need to work upon the synaptic plasticity.
So yeah, I understand the concept. I understand the logic and the concept. Basically, we know that brain plasticity. We also know that if the pathway doesn't work, the brain would rewire rewire the pathway. Even though there's a damage. So basically all the nerve would regrow on to get to the pathway that we wish to get.
Yes.
Okay.
Exactly.
Okay, I got all that. Now it's just interesting because the case for Parkinson or cardiac arrest or bradycardia or tachycardia, those are very interesting. Those are internal medicine area, which is very interesting. Now, this is what I was because he was treating that case, so I just followed that case.
Shastri sir would be able to do all these work in all these areas of the brain, all these areas, whether the patient is of hyperthyroid, hypothyroid, or hypertension, whatever medical condition it may be. So sir would be able to work upon all these areas.
Yeah. Okay. All right. So we just have to wait and see until we reach to that area after this neuromuscular class
Yes.
is complete.
Yes.
Okay.
So sir basically initially want us to, you can say, to get all the basic concept first. Only then we will be able to understand about the higher concepts or the advanced concepts.
All right. Okay.
Yeah, that would be more with the, you can say, in the practical one-to-one sessions when we have with the Shastri sir. At that time we may be able to understand the advanced things much better. Okay.
All right.
For
All right.
meanwhile, for the time being and for the meanwhile, we need to have a strong basics. Only then we will be able to understand the advanced things. So that is what we are working upon here.
Okay.
Yeah.
Got it. Thank you.
Yeah.
Thank you, Doc.
Okay. Any more questions? Okay, we may do it tomorrow only because we have less attendance today. Maybe few may join tomorrow. So we'll take on tomorrow only, and that's it for today. Thank you, everyone.
So,
Thank you so much.
So just a quick recap. Sir said, or Dr. Rahul said, in March onward, from March onward, we will have Monday to Friday class. Saturday may have class, right? And Sunday we will not have class.
Yeah.
Okay.
Yes.
Please take note, everybody.
Yes, sure win.
Thank you. Yeah, thank you.
Oh,
Pranam sir, thank you so much.
no. Thank you.
Pranam sir, thank you sir, thank you so much sir.
Thank you,
Thank
sir.
you, Radha.
Thank you, sir.
Thank you so much.
Thank you. Thank
Thank
you,
you, sir.
everyone.
Thank you everyone.
Thank you, everyone.
Good night everyone.
Good night. Good night, everyone. Love you.
Thank you all.
Good night. Yeah. Arlene. See you all. Long time no see.
Good night.
Yeah. I miss you all. Miss you all.
We don't have class for 9 days. Okay, good night.
Good night. Long weekend lah. Long holidays.
Yeah, okay. Okay, I stop. I end lah. Good night.
Bye, baby.
Bye-bye.
Okay,
Bye-bye.
thank you.
Thank you.
Thank you.